Sure it's recording. It's recording.
Good morning, Todd County. Welcome to the Tuesday, October 3rd, 2023 Todd County Board of Commissioners regular board meeting. We're going to do some roll call here. Today we have Commissioner Denny, Commissioner Becker, Commissioner Noska, Commissioner Newman present, along with the Auditor Treasurer Guida and Coordinator Pelzer. The county attorney is absent. Will you please stand for the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Once again, good morning, everybody. Is there any amendments to the agenda?
Yes, Mr. Chair, I have a remove item 4.9, the hire of Richard Berry. Please remove that one. And then we will be adding under administration 10.2, Chris McCon and the transfer station cover project.
Okay. Any other amendments? If none, I'd entertain a motion to the amended agenda.
So moved.
Motion by Noska. Is there a second?
Second.
Second by Denny. Discussion. If none, all in favor signify by saying aye.
Aye.
Opposed? Carried. Thank you. Consent items.
Consent items today are the meeting minute approval for September 19th, 2023. Resignation of Emily Olson, seasonal worker, 9/1/2023. Accept retirement of Lori Becker, highway accountant, 12/15/2023. Retirement administrative assistant Dina Callahan, 12/28/2023. Appoint eligibility worker Jessica Miller, start date to be determined. Accept the resignation of Melissa Moranzan, full-time jailer, 10/5/2023. And accept resignation of Letitia Harden, full-time jailer, 10/5/2023. Hire Ethan Weiss as part-time road deputy, start date to be determined. And approve the 2023 tobacco license sidewalk saloon and grill.
Okay, I've heard the request. Is there a motion, please?
So moved, but with my motion, I would like to thank both Lori and Deanna for their long time working with the county. A special thank you.
I'll second.
Motion by Becker, second by Noska. Any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed? Carried. Thank you. Oh, great. Now we started something new this year, and we're gonna honor the third quarter service awards. So when I call your name, please come up and stand by the commissioners here, and we'll get a picture once we're done. And today we're gonna honor Rocio Ramos. Come on up.
So, Mr. Chair, Rocio is with Health and Human Services. She is a support enforcement aide, and she's been with the county for 5 years.
Nice.
Thank you.
You'll stay there?
Stay here?
Yeah.
Yep, stay up here. Yep. Next, 5-year service award, Christy Dahl.
And Mr. Chair, Christy may not be able to make it. She actually starts her shift at 10. So Christy is with the Sheriff's Office. She is a dispatcher, and she's been here for, I have 5 years.
Okay.
Okay.
Thank you. Thank you, Christy, for the service. Samuel Larson, 10 years.
And Sam would be the same. He is on shift. He was going to try to make it, but I see he's not able to. But he's Sheriff's Office, road deputy, 10 years.
And we thank Samuel for his 10 years of service. Okay, and the next individual, Michael Zimmerman.
And Mike was going to try to be here, shifting again, solid waste, truck driver, 10 years of service.
Okay, and we congratulate him on his 10 years of service also. So we're going to have our picture taken.
Well, that's pretty special, isn't it?
Yeah, I guess.
Oh, maybe Randy's chair needs speaking?
Oh, there. Sorry. And thank everybody today for your service to Todd County. Auditor Treasurer.
First item I have today is the auditor warrants. Background is sent for your review. Recommendation is to approve the September 2023 auditor warrants with an ACH and a manual payment totaling the amount of $1,748,411.85.
Okay, you've heard the request. Is there a motion, please?
So moved.
Motion by Danny. Is there a second?
Second.
Second by Becker. Discussion. If none, roll call vote.
Commissioner Danny?
Yes.
Commissioner Becker?
Yes.
Commissioner Nazca?
Yes.
Commissioner Newman?
Yes.
Thank you. The next item I have then is the commissioner warrants. Background is sent for your review. Recommendation is to approve the commissioner warrants with an ACH and a manual payment totaling the amount of $111,509.14.
Okay, you've heard the request. Is there a motion, please?
So move.
Motion by Becker. Is there a second?
Second.
Second by Nazca. Discussion. If none, roll call vote.
Commissioner Becker?
Yes.
Commissioner Nazca?
Yes.
Commissioner Denny?
Yes.
Commissioner Newman?
Yes.
The next item I have is the Health and Human Service Commissioner warrants. Background is sent for review and the recommendation is to approve the Health and Human Service Commissioner warrants with an ACH and a manual payment totaling the amount of $42,976.64.
Okay, you've heard the request. Is there a motion, please?
So moved.
Motion by Nazca. Is there a second?
Second.
Second by Danny. Discussion. If none, roll call vote.
Commissioner Nazca?
Yes.
Commissioner Denny?
Yes.
Commissioner Becker?
Yes.
Commissioner Newman?
Yes.
And the last item I have is the Health and Human Service SSIS warrants. Background is sent for your review. And the recommendation is to approve the Health and Human Service SSIS warrants with an ACH and a regular manual payment totaling in the amount of $56,760.75.
Okay, you've heard the request. Is there a motion, please?
So move.
Motion by Becker. Is there a second?
Second.
Second by Danny. Discussion. If none, roll call vote.
Commissioner Becker?
Yes.
Commissioner Denny?
Yes.
Commissioner Nazca?
Yes.
Commissioner Newman?
Yes. Okay. Okay, now we're going to open up the public hearing for the 2024 Todd County fee schedule.
We have had no comments or questions or concerns asked of my office during this time since we've been posting that we'd be having this public hearing. We did some investigating with neighboring counties in regards to I know last time the $50 fee that I was adding in my office was questioned. There's other offices in the county that do implement that. And like I said last time, we're just implementing it for items that come across our office desks that are requests to do research that don't fit in any of the prescribed categories we already have. And so Pope County does, we pulled up Pope County, Morrison County, and Stearns County. Stearns County does have an office fee of anywhere from $45 per hour to $60 an hour. And then Morrison County has a research fee after the first half hour, or after half hour per day, it's $30 an hour. And then they also have an official service fee of $20. And so that's kind of where our $50 is at. And then Pope County has a research fee per hour of $40 with a minimum half hour. So they charge $40 even if it's just under an hour. And then they also have a computer report setup fee that they charge $200 for, and then $100 per hour after that setup fee. So this just happened to be an area, like I said, where we would have, an example I gave last time would be, we had a gentleman that requested non-public data, but it was for his own personal use because he was going through a big court process. And the court sent over actually orders to us to go back like 15 years of all of his tax payments. And they didn't want just the history of what he paid. They wanted his actual check prints from our bank statements. So that took a lot of time. We had to go out to our online site, try to pull the check from each batch. Well, you know, if you're paying on time in an October or November or May settlement, we're talking about millions of checks that we process in that, you know, time frame. So, I mean, it's labor intense, and so that's why we opted for doing that. But again, like I said, no other comment than that one comment you asked last week when I presented it at the work session, or 2 weeks ago, excuse me.
Okay, is there any other comment while we're here? Okay. I do have a question though. So if they want information, do we have a form that they have to fill out?
There is a request form that we have.
Yep.
And then a lot of times just whether it's a letter or an email, or if court sends something over, there's a documentation that we know what they're requesting.
Okay,
But yeah.
all right. Well, we will close the public hearing and move on to the next item. And we have today joining us, Hands of Hope. Please come forward. Pull up a microphone. We went with new wireless mics, so
Good morning.
good morning.
Morning.
October is Domestic Violence Awareness Month, and we're here to do a proclamation, to ask for a proclamation. Whereas domestic violence is not just a family issue, it is a crime and should be the concern of all Minnesotans. Domestic violence is also the leading cause of homelessness amongst women and children in Minnesota. And whereas victims often suffer long-term physical and mental health issues upon leaving a violent relationship, the costs in medical bills, lost wages, court costs, therapy costs, etc., cost Americans billions of dollars every year, not to mention the destruction of families, friendships, and communities. And whereas in Minnesota in 2023, there have been 23 domestic violence homicides to date, with 3 months of the year left, Hands of Hope Resource Center in Todd County has worked with 100 Hands of Hope has worked with 100 primary victims, both men and women, so far this year, as domestic violence is not gender specific. And now, therefore, be it resolved, Hands of Hope Resource Center will continue to advocate and support crime victims, survivors in their search for justice and safety. Our agency seeks continued support from the county commissioners, our judicial system, our law enforcement, and our communities. And be it therefore resolved that Hands of Hope Resource Center asks the Todd County Board of Commissioners to proclaim October 2023 as Domestic Violence Awareness Month in Todd County, and continue to support Hands of Hope Resource Center in educating, advocating, and promoting positive change for those living in this violence and abuse. And thank you for all the years of support with our proclamations.
Thank you for everything you guys do. Do we have a motion?
So moved.
Motion by Danny. Is there a second?
Second.
Second by Becker. Discussion. If none, all in favor signify by saying aye.
Aye.
Opposed? Carried. Thank you so much.
I'd also like to introduce our newest employee.
Hello, my name is Cassandra Ortiz. I'm the General Crime and Child Abuse Services Coordinator for Hands of Hope.
Thank you and welcome.
And Barb Goodrich and Steph Ock, their team, so,
Thank you for everything you guys do.
thank you.
Mr. Chair, they did ask if they could get a picture with the board.
Yep. Can you get us all in?
There we go. Thank you.
You guys have a great day.
Thank you.
Public Works.
Good morning.
Morning.
So our first item on the agenda this morning for Public Works is a request for the authorization to final out our 2022 highway construction contract. Our options are to approve or do not approve the attached resolution. Our recommendation is to approve the attached resolution, making final payment to Central Specialties for $286,917.08.
Okay, you've heard the request. Is there a motion?
So moved.
Motion by Nazca. Is there a second?
Second.
Second by Danny. Discussion. If none, all in favor signify by saying aye.
Aye.
Opposed? Carried. Thank you.
All right, thank you. Our second item on the agenda is a request to nominate a project for the Local Road Improvement Program. And if I may, I'll just start by explaining the Local Road Improvement Program. This is a program that's part of the state bonding bill that was passed by the legislature last year for counties to apply for funding of state bond money for specific types of projects. This one in specific would be a route of regional significance. We have this project specifically scheduled in our 5-year plan for 2025, or 2026, excuse me. And we consider this a route of regional significance because it basically connects 2 state highways, Trunk Highway 287 and 71, and also has the Todd County Long Prairie Airport on it. Therefore, we figured this would be a prime candidate and would basically increase our chances of getting funding for this project. So with that, if we want to scroll down some of the improvements that we'd have on that road, we can scroll down to the map I think I have attached to there. So basically it'd start basically on the west end there by Round Prairie going east and then north up to 287. Specifically, some items we'd be looking at is mill and overlay. We'd be replacing all the deficient pipes, lining all the other pipes that need to be lined. And then basically we'd be raising the grade in that little area there just by the airport. A number of years ago, we had some flooding issues in the winter where the water would come up and then we'd have to pump all winter long, which kind of become problematic as you're pumping water in the winter. It gets somewhat challenging. So we figured with this project, we could alleviate that, raise the grade up 2 feet and eliminate that issue. So with that, we figured that's our best candidate to apply for this money. Therefore, we're requesting approval and approve the attached resolution nominating this project as the Todd County project to be included in the Local Road Improvement Program.
Okay. All right, you've heard the request. Is there a motion?
So moved.
Motion by Denny. Is there a second?
Second.
Second by Becker. Discussion. If none, all in favor signify by saying aye.
Aye.
Oh, carried. Thank you.
All right, thank you.
Lauren?
Administration.
Thank you, Mr. Chair. I have a board action this morning to approve comparable counties list for use with a classification and compensation study. And the background is Todd County has begun a classification and compensation study with Gallagher. Part of the process is to conduct a survey with comparable counties to gain insight on benchmark positions. Discussion was held at the September 19th work session on determining comparable counties. Additional analysis was conducted and presented to the Personnel Committee prior to bringing forward for board approval. And the options are to approve the list of comparable counties as presented to be used with the classification and compensation study being conducted by Gallagher, or to not approve, and the recommendation is to approve.
Okay, you've heard the request. Is there a motion?
So moved.
Motion by Nazca. Is there a second?
Second.
Second by Danny. Discussion.
What counties are you using?
Yep, so Gallagher had requested that we choose 25 counties. So what I've put together for you, just for a little bit of additional discussion before a decision is made, and Denise, if I can have you just pass this to the commissioners. So just to explain the data a little bit, every county that's highlighted, that's a total of 30. Gallagher is looking for 25.
Yeah.
So I'm sure they would accept the 30 if the board chose to use all of them. But we based the criteria of the weighted counties on First and foremost, we looked at the counties that touch us. So we looked at our contiguous counties, and on the map, those are identified with the C. We also looked at Region 5 counties, which we get compared very often to our counties within the Region 5. And then from there were 13 total criteria that were used, including those contiguous and the Region 5. And those numbers that you see on the highlighted counties are the number of hits in that specific criteria. So we looked at population, we looked at households, we looked at certified levy, tax rate, tax capacity, total market value, land building ratio, building values, land values, square miles, and median household income. And from that, Denise, I think if you scroll, we'll see a list of actual counties. There we go. Yeah, so this is how the counties ranked, and again, this is a commissioner decision, but we put the most weight on those contiguous and Region 5 counties, even if those counties did not get hits in other areas or most hits in other areas, because they are touching our borders. We felt that was important, and they were given a score of 13 automatically. Down towards the bottom, you'll see a couple of highlighted areas for consideration. So we had a number of counties that came in with a criteria of 5, a ranking of 5. And with those counties, looking at specifically Cook, Roseau, and Waseca, if population is a high factor, they don't hit that mark. So if we wanted to exclude a few counties, we could look at excluding Cook, Roseau, and Waseca because they don't hit one of our pretty common factors, which would be population. If you look at Cook and Roseau specifically, they also don't match up with our levy. So that might be an easy thing to say we can exclude them. Fillmore did not match up with our certified levy, and I think Wabasha also did not. So there are 5 counties that are highlighted. The board could choose to remove those specific 5 counties, or we could just continue discussion.
Okay, what's your guys' thoughts?
I think during personnel and some of the discussions that we've had as a chair, vice chair, we talked about taking out Stearns and adding one more of the 5 counties, because Stearns is so much out of our, I mean, they're continuous to Todd, but the St. Cloud area and closer to the cities is so different culture than what we are. We talked about leaving Roseau in and taking Cook out. So those are just some of the discussions that we've had beforehand.
And Mr. Chair, if you look at what Commissioner Becker speaks to, even with Stearns County specifically, the only thing that we have in common with them outside of being contiguous, which is important, is really the square miles, the footprint.
Yeah.
So.
Right. Because we'll never be able to compete with Stearns.
No, we can't.
Ever. You know, with the size, with the population, with. Any other discussion, guys?
And I guess during our discussion, we had leaving Roseau in because it was a northern county and not just all southern counties.
And Roseau's got Polaris, they got.
Yeah.
They have Marvin, Windows.
The population isn't that much lower than us, I guess. Roseau's
Yeah.
not, but
If I could just also just kind of piggyback on
But
what
Cook
Commissioner
would go.
Nasca is saying, the household size and the population almost match identically. So I would have to guess, looking at Roseau, that population is right on the cusp. So,
Yeah.
yeah, pretty close.
So we're just down to getting rid of Cook right now? For sure.
Eliminate Cook.
To eliminate Cook.
sure, out.
Cook, leave the rest.
How about Stearns?
I agree. That needs to be swapped, I think.
You know, because, you know, we've got Otter Tail left in there. We've got Crow Wing still because they're with Region 5, so we have some high-paying counties already in there.
Are we leaving Wasika in there then too? That one should really, with the population, should really, I mean, way above and beyond.
Right.
I mean, Stearns is more comparable than Wasika would be because it's a tiny county with a huge population.
But Waseca's got the levy and tax rate, tax capacity,
Right.
which is a lot more comparable than Stearns.
Say, Chris, I got a question on Wasika. Is that 103,000 for a household?
Median income?
It was, and I could not validate that one specifically. That seemed like an error. The rest of them seemed actually reasonable. That one jumped out at me as it could be an error.
Wow.
The rest of them made sense.
Okay. Okay, what's wishes, you guys?
So as of now, just to kind of keep the tally, I have remove Cook, remove Stearns, leave Roseau, and then we're questioning Wasika.
If we should
Yeah, let's take Wasika out.
take it out,
Yeah.
where are you coming?
What do you
Take out
think?
Waseca?
Yeah,
it out.
I would take it out. It's just not really comparable.
No,
Okay.
because
Yes,
it's like,
some of the numbers are comparable, but
the 103 really jumps out. at me.
Yeah.
it's a high income
Yeah.
per household.
Okay.
It's like, wow.
So that would leave us with 26 counties, and I'm sure Gallagher would be fine with 26 instead of 25, if you would like to just go with that.
Okay. So I'm gonna request a motion here. So,
Yeah.
Did you already have a motion, though? I thought you had a motion
did.
and a
We'll make a-
second.
We had a motion and a second, then we had discussion, and
And
I
then we
have
had
documentation
discussion.
of
Yep.
removing specific ones.
yep, motion by Nazca. second by
Okay, so the
Denny. Yep,
motion would include the Pacific ones then,
Yep,
Yep,
if that's all right?
good deal.
yep.
Okay.
Good with that?
Good.
So we're gonna eliminate Wasika?
Eliminate Wasika, Cook, and Stearns.
Yep.
And the rest
Keep
stay.
Roseau.
Rest there.
And everybody's good with that?
Yep.
Okay. All in favor signify by saying aye.
Aye.
Opposed? Carried.
Thank you.
Good discussion. Solid waste. Come on down.
Good morning.
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 Good morning, Chair and Commissioners.
I have it. My bad, sorry. I did have it.
So I'll just read the background. Bids were opened on last Thursday, September 28th, for construction of a final cover on portions of the demolition landfill that are at grade. 7 bids were received. The low bidder was Bursky Excavating for $194,725.75. And there's an abstract attached. Upon review of the bids received, engineer of record Nick Kusa of WSN has recommended that the county award the project to Bursky Excavating. This project was approved by the Board of Commissioners for ARPA funding in the amount of $700,000. So our recommendation to the board is to award the project or the bid of Bursky Excavating for $194,725.75 and authorize the solid waste director to sign the contract upon receipt of necessary contract documents.
Okay, you've heard the request. Is there a motion?
So moved.
Motion by Nazca. Is there a second?
Second.
Second by Denny. Discussion. This also has been reviewed by the county attorney and was green lighted through him too, so,
It's a big savings compared to what we thought it was.
yeah,
Yeah. It leaves some funds open for other things.
yep, it's a good thing.
Yeah.
Okay, any further discussion? If none, all in favor signify by saying aye.
Aye.
Opposed? Carried. Thank you.
Thank you. We just would
Thanks.
like to thank you for letting us use the ARPA funding to get this done and have that landfill closed.
Yep. We're excited to get her done.
Thank you.
Thanks, guys.
Okay, we're down to standing reports. Auditor treasurer, what do you got?
The only thing I have is tax season has picked up, just to remind, taxes are due October 15th. And also absentee voting has been open, and that's really picked up. And we did have a call, somebody was questioning curbside voting, and yes, that is a service that is offered. It's just kind of nice if they call ahead, because we have to have 2 election judges carry out the application, carry out the ballots to the car, and if they pull right up here in the handicap parking spot, we do that. We did that a lot during COVID. So if there's elderly or somebody that's not feeling well and don't want to come in and vote, that curbside voting is available. So that's just the message I wanted to get out to the public.
Okay, and that's a good service to have. Okay. All right, county attorney is absent, so commissioners report. Let's go first. Mr. Becker?
Okay, I had insurance meeting on 9/20, Rainbow Rider on September 21st. We had facilities on Friday, the 22nd. As you guys can see, the roof work is being done. It looks really good out there. Public hearing for the Mississippi watershed, and that was held over at Camp Ripley. And it was voted during after the public hearing to move it forward. So the counties, each county will be receiving that to be approving the Mississippi watershed. Personnel on the 27th, we had Region 5 last week on Thursday, regional EMS on the 29th, and yesterday afternoon we had a wellness meeting.
Yeah.
That's all I have.
All right. Commissioner Denny?
Since our last board meeting, we had Great River Regional Library one, Hands of Hope, Prairie Lakes Emergency Service Boards, and a CPT one, and nothing exciting. It's just business as usual. That's all I have for you.
I was out of state all last week, so I missed a couple. I was in Florida, and I guess it was hot, but it was hot here too, so. I don't really have anything to add.
Okay. All right, I had, on the 20th, I had an opioid meeting, and the balance right now is like $213,751.71. So there is some funding there. So Commissioner Denny, I know you've been kind of active on that.
Yep.
So there's funding available.
Perfect.
So, later that day, we had an insurance meeting. On the 21st, we had Rainbow Rider. 22nd, we had facilities and a safety meeting. And then on the 27th, I had personnel, and that's it. And tonight, we have County Ditch 40, so that's all I have. Coordinators report.
Thank you, Mr. Chair. A number of the same meetings that you've attended, I've attended as well, the internal meetings. Just a note that you are already aware of this, but Master Gardeners put in some really nice shelving in the grandstand, and they have donated that to the county. So that was great to see that cleaned up, and hopefully will be a nice addition for next year's fair. We did also have the closing on our last property that took place last week. So those two are now owned by the county, and we can start doing work with that. And our office is pretty busy with the class and comp study at this time, so things are moving forward as planned.
Okay. Is there anything else that needs to come in front of this board today? If not, we will recess to October 17th. Okay, we are recessed, and we'll start the work session in 5, so like 9:40. Okay, thank you. so we're gonna,
You're ready.
right? All right, welcome to Tuesday, October 3rd, 2023, Todd County Board of Commissioners Work Session. On the agenda today, we have a Health and Human Services update. Come on down.
Oh, thank you. Very good.
Oh, thank you.
Is there gonna be a test after this?
Yeah.
Just checking.
Thank you.
Okay, all right. Thank you.
I was told I had to go first because my name was first.
Perfect.
Get to go first, Catherine. I get the opportunity to go first. Thank you. All right.
Okay, good morning, everybody.
Good morning.
Okay,
All right, so just brief updates. Jackie asked we come annually to do brief updates on our unit. So again, I supervise the community health unit, and with Commissioner Denny and Commissioner Noska, I know you're still fairly new. So just to remind you, especially with the closure of our home care, now I do almost all of our public health programming. So I'm going to give a very high level update so we can get to more important, exciting matters here. And the people next to me. But it's strange to talk about, but we're still recovering from COVID, right? So I think one of the big things we all learned during the COVID pandemic, which was our Super Bowl, as we like to talk about it in public health, it was very exciting. We had prepared, and yet we still have a lot of lessons learned from that pandemic, and especially around how we best reach our hard-to-reach populations in Todd County. So that's mostly our Amish population and our Spanish-speaking population. So what we've done over the past few years, and I apologize if this is kind of loud, is really think about ways that we can do better, right? Reaching those populations, doing outreach more effectively. So right now I want to talk a little bit about our Amish outreach program we've been working on with our healthcare systems. Dr. Van Gorp, as many of you are aware from CentraCare, has been working with that population for a long time, as well as Astera Health out of Wadena. They have 2 nurse midwives that serve that population very effectively. If you didn't know, 1 out of every 5 babies born in Todd County is a home birth. So that's 20%, 60 babies last year were planned home births in Todd County. So when you think about that, another 20% is to our new Latina population coming out of Central America. So 40% of our births in Todd County we're seeing are from our hard-to-reach population. So it's a growing demographic. Specifically with our Amish, what we found over time is that the best way to do outreach and to get into a way to increase healthcare access is with the prenatal population. So when the moms are pregnant, typically they have a midwife from the community that serves them, but they're starting to access more of the midwives locally. So there are some for hire midwives, and then there's also midwives that come out of Astera, like I referenced. And what we're seeing is better birth outcomes. We're seeing now about 1 about every 3 deliver in a hospital instead of at home, which again, as you can imagine, really helps to improve the outcomes. We just had a 32-week baby born at home that almost passed away. So we're also working to train all the midwives, the lay midwives that are in the community, so that they're aware of when they need to call the doctor, when they need to get that mom to the clinic or the hospital, right? Because I think what we'd experienced in the past is they would wait till the last minute. And then that baby comes or that mom comes and it's under extreme distress. So we're really working hard on that. I think we really, as we all do, want better birth outcomes for all populations. And specifically with our Amish, we have a lot of opportunities now to talk about ways to get those moms the care they need, to get into their homes, to go to them and provide that prenatal care and awareness so that they're aware of what does it feel like when I'm going into preterm labor? What does that mean? What do I need to do? So just wanted to touch on that a little bit. Also with some of our COVID response, and again, how we're trying to better serve our at-risk populations is our Spanish-speaking, our new immigrants. As you're well aware, we have a lot of immigrants coming from Central America now, not so much from Mexico like we previously saw, Nicaragua, Venezuela, Guatemala, that often come here for work. And then a lot of the women surprisingly get pregnant, unfortunately, or not when they plan to, and come here with no family, no supports, nothing. So we've supported a lot of those moms as far as getting them what they need to ensure that they have a healthy pregnancy and birth, and then helping them with housing, transportation, making sure that they can find childcare and go back to work. So that's been a lot of our work as well. I think what's most important is that we recognize that every culture is different, right? And so we're trying to culturally meet them where they're at. Some of those ways that they care for their infant, or ways that we provide our nursing, our public health nurses go out, is different. And so we work closely with WAVE and VITA. Those are our local Latino liaisons that work with us, so that we make sure we're providing appropriate care for those families as well. I'm going to stop there. That's all I wanted to give an update on, because I think it's two exciting things we're working on in public health right now that are really important. As you guys know, I do lots of other things, and if there's ever any questions around public health programming, I know Commissioner Denny, we've spoken about those opioid settlement dollars. I'm happy to talk about it, but that's my 5-minute update. Thank you.
Yes, I will be your companion after you explain your exciting programs. I will share how they're funded.
Good morning.
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 First of all, I did want to say, offer our thanks for your support in the last couple of years. They have been challenging, and we feel like we've got support from you, and that's very much appreciated. Some good news as far as today's approval of our new eligibility worker, we should be fully staffed. So that hasn't happened in a while. So we're looking forward to that. We're optimistic. Got a good team going. That being said, we do have 6 workers who have been here less than 1 year, and 4 workers here 3 years or less. So that's a large percentage of our workers are pretty new. We're seeing great things from them, but the training and everything takes, is a struggle. The unwinding with healthcare is adding complexity to pretty much everything. But they're working at it, and they're doing well. Policy and procedures, they just increase in complexity every day. It really is true. As far as the cash food support programs go, cash housing support, individual and families, has remained fairly steady. We haven't seen much change in the last 5 years. SNAP, however, has average intakes have almost doubled from 2018 to this year. We currently have 170 more SNAP cases right now than we did in March of 2020. So that's 170 individual cases. Same number of workforce, however. So the average intakes in a month in 2018 was 44, and 2023 through September is 87. So that's a monthly total of new intakes. But like I said, family and individual cash and housing support have remained pretty steady. Healthcare also, renewals have begun. Laura will speak on the Met side, the families and adults without children. As far as the elderly and disabled, it's remained fairly steady as far as intakes go, but we're seeing a gradual increase, which would be expected with the population aging, newly Medicare eligible. There is a new process with the unwinding. DHS does continue pretty much constant changes. There's a completely new renewal process for those Maxis cases for healthcare that has increased the complexity. It's pretty much tripled it. So they're looking at splitting. They can be looking at 2 months ahead or 3 months ahead of time, where they have some people need to be auto-renewed essentially, but there's no system availability for that process. So they're having to do it manually. It's very confusing, keeping up with which month they're in, which individual cases. It's been going fairly smoothly, but it's increased the complexity. And with the increased intakes, it's it's been tough the last couple of years, but they're getting through it, and I think they're doing well. Time-limited rules for SNAP, so that would be the work requirements for SNAP began in July. So that's where they get the 3 months. 3 months in a, is it 36 months? Yeah, 3 months in a 36-month period. And then they have to follow the work requirements if they're, required to. That would have, any closures related to that would have happened October 1st. So we haven't really seen what the reaction is going to be to that. That, again, has increased the complexity of the SNAP program quite a bit. And then the eSNAP, the pandemic eSNAP, and the school-age children EBT issuances, they have completely ended as of September. So they have that all wrapped up. That was going through all through COVID.
Stephen, can you tell commissioners what SNAP stands for?
SNAP would be the Supplemental Nutrition Assistance Program. So the food support used to be known as food stamps.
So I got a question. So how many programs does an eligibility worker have to know?
Well, we have 4 dedicated healthcare workers in METS, the METS system, which is the Families and Adults Without Children, which is our largest, population of a program. The other workers, what we would call generic workers, we have some specialization, so we have 3 long-term care, but they have to know all programs. So they just happen to specialize in long-term care, but if they'll have people on food and cash, individual cash. So what would the total? Yeah, it would be 5 or 6. Yeah, I believe 6 programs total. So it can take up to 6 months just to get the classroom training done.
Okay.
That's not really, they learn on the job, so.
So what's the average time of implementing those programs? So if somebody comes in and says, I want to get on this program, how long does it take from the start of the first contact to them getting onto that program? Is it?
Each program is different. All programs have a 30-day. Healthcare is different. So healthcare is based on what the population is. So elderly and disabled have 60-day processing period. Others have 45 days for healthcare, and then pregnant is 15 days. SNAP, cash, housing support, all those programs would be 30. There's a 30-day processing period.
Okay.
Emergency.
Yeah, emergency. Yep, emergency, county burial also are 2 things that the eligibility workers have to know.
Okay.
8, yeah, it would be 8 programs.
In a perfect world, if you're able to connect with those individuals to complete the application, I think what Stephen, Laura, and Julie could tell you, there are a lot of pending applications because they have a hard time reaching back out to those individuals to get the information they need to process those applications. So a lot of them time out, but constantly trying to reach out to them to get the information to process the application is part of the problem.
Okay.
Yeah, so when I say that there's a 30-day or 45-day processing period, that's the timeline they're allowed. Healthcare, we are a little bit more lenient depending on the situation. We may allow, if they're trying to reduce assets, that type of thing, we may allow them to pend longer than that required period.
Okay.
Continuing on with the healthcare, the MET side, our case numbers haven't really fluctuated simply because of the continuous coverage. So right now in Todd County, the case total for MET's MA that we're maintaining as Todd County is 2,332 cases or 5,438 individuals. And then Minnesota Care cases we're maintaining here in Todd County, 168 or 227 persons. Again, that hasn't fluctuated much since 2020, again, simply because of that continuous coverage that was in place. Now that we've resumed renewals, what we refer to, and you heard Stephen mention it, as that unwinding period. Initially was supposed to be July of 2023 through June of 2024. So the cases that were open who haven't received a renewal in the last 3 years would then have their first actual renewal starting in July. However, certain barriers and system limitations have created what we're assuming is a longer timeline for that, and a lot of changes coming down from the state to ensure that those who are eligible remain open and covered in METs. And so what that's looking like in the future is still up in the air. So there's been a lot of last minute changes and workarounds that workers have had to do and implement, but they're all taking it with stride and just essentially doing the best we can with the policies and procedures that we have as of today, and knowing that, you know, we have to be aware of those changing even in the upcoming days or weeks. As far as child support goes, I have some numbers. In the federal fiscal year 2022, Todd County distributed $2.9 million in child support collections. That's both on current obligations and collections on arrears as well, or past due support. We continue to exceed the statewide average in all 5 performance measures. And those performance measures, as a reminder, are paternity establishment, order establishment, collection on current support, collection on cases with arrears, and then cost effectiveness. We continue to, review our current procedures, look at creative ways to increase those numbers as well. As far as 2023, I don't have actual numbers, but through the end of through the end of August, we're at about a 78% collection on current support. So that's an increase that we haven't seen in the last several years. So workers continue to focus on enforcement efforts, and then just making sure that the orders that we do have in place are fair. One of the biggest highlights, I think, for 2023, or noteworthy changes really, would be that they updated the guidelines calculation to kind of tailored to more individual situations, and then also to incorporate the current cost of living. The prior guidelines was based on economic data from over 20 years ago. So any case that is being reviewed, we're seeing a more fair or appropriate order resulting from that. And then, they've navigated, or we continue to navigate, a lot of statutory changes, one being like a driver's license suspension, and different processes and policies around that. So looking forward to a couple other legislative changes that will take place here between, 2025 and 26 that they're going to be implementing. But yeah, it continues to be a really good program, and we've got great workers there as well.
Good.
That's what we have. That's our 5 minutes.
Well, you took 10.
We better wrap it up.
That's right. So I just wanted to share a little information about how the county is paying for all of this work that these staff are doing. We have 17 eligibility workers and 6 child support workers, so those are the people that are doing this work. And roughly, when all is said and done, you take your total expenses, and that would include administrative expenses, direct staffing. Income maintenance is the term that they use for the work that the eligibility workers do. So it incorporates all of the programs into income maintenance programs. So you'll see that term a lot. And I just thought it might be helpful to know what some of those things mean. We earn federal financial participation money on this work. So in 2022, we earned 50.21% back on all of our expenses. And it's split down into these pots down below that say administrative aid expected. I'm showing you the 2024 budget, so these are the actual numbers that we have in the budget for 2024. All of the staff, the eligibility workers, participate in random moments. So I believe it's 5 a quarter or 5 a month.
Something around that, yep.
They will just get a random moment that says, what are you doing right now? And so they answer what they're doing. And then those answers are compiled with, most of the state gets put into a pool. All the smaller counties, there's only about, like Hennepin County is their own, you know, some of the larger counties, but our county goes into the statewide pool for those answers. And then the results are how they pay us our administrative aids. So if you look at like the 0.3 and the 4.68 and the 0.07, that is how staff are answering their random moments on average. So this was for 2022. And so then from that, you get an FFP earning percentage put on that. So for example, the MA, which is medical assistance, federal admin aid, 21.96% of the time, that's what workers were doing. And so of the 50.21% that we're gonna get reimbursed, 22% of that will go into that federal admin aid bucket, and then we'll get 50% paid back. So it really, it's important how the staff answer these, because of course some of the aids do provide better, like they've made that enhanced MA, federal admin aid, and that's when METS came around. So staff who are working directly in the METS program during a random moment, then we receive 75% on those. Child support is a direct charge, so they don't answer random moments. We just charge 100% of their time to the child support program. And then any of the overhead that is directly attributed to child support also goes right to that program, because we earn 66% on that, so that's a little higher rate. So the rest of the other half, basically, is covered. We receive some child support incentives. We use our MA estate recovery program to try and offset some of that. Just this year, so far, we are at $546,000 that we've recovered back for medical assistance estate recoveries, and roughly the county keeps 25% of that as an incentive for the work that we do. So we try to find ways to maximize that difference, and the rest is county levy. So whatever more we can do is what we work toward. There are a few programs that are state programs that the workers do, and we don't get any FFP for those programs. That's child care assistance, general assistance, MSA, GRH, which has been renamed to housing support, and Minnesota Care. So if they happen to be working on one of those programs, yeah, we're out. So it's not quite 100% counted, but it averages out to the 50.21% that we will receive federal. And that's what I wanted to share with you today.
Wonderful.
Yeah.
Guys got any questions?
Has the percentage changed on the amount that we get paid back from the state or not?
Not in many years.
It has
no.
not changed.
It always averages right around the 50% mark.
Okay.
Might be slightly up or down, but.
So I have a question. So with the borders being pretty much wide open, are we starting to see an influx up here in Todd County as far as that being open? I mean,
I would refer that to this group here who would see those people.
Yeah, I would say yes. I know Catherine too has seen that with public health. That's another, we didn't even touch on that, but the immigration side of it is almost like a separate program. So for right now, we really have one worker that is well-versed on the immigration policies for the programs. So yes, we have seen an increase.
Excuse me, Mr. Chair. Is there a percentage payback if they're working on that?
Yep, that is actually refugee assistance is 100% federally paid. But we have a very 0.02% of the time are people working on that program, so it's
Okay.
very small.
And refugees and asylum status is different than immigrants who are here illegally, right?
Sure.
So again, refugee status is Ukrainians are refugees right now. Asylum status is war-torn countries like Haiti, Cuba, Venezuela, right? So we see, and that's different. They are able to seek assistance. Our new immigrants who are here illegally for work and brought here to work, those who are pregnant are able to be on medical assistance while they're pregnant and 1 year postpartum. This is the only part I know. You guys can correct me. When that child is born here, they're now a citizen, right?
That
So they're
child is a
eligible.
citizen, yep.
Yep, so that's where, yes, we're seeing that, and many of them are seeking, you know, citizenship. But as far as being eligible for programs,
It differs based on like what Catherine was saying, whether they're asylees, refugees. So there's refugee cash assistance, there's emergency medical assistance. So it depends on their immigration status.
Are we seeing that more within the Long Prairie area, or is it spreading out through the county? I mean, I see it picking up maybe in Browerville a little bit. I mean, are we seeing it spread?
so Commissioner Becker, that has a lot to do with housing. There's no housing in Long Prairie, and so we're seeing a lot of those who come here for work have to move further and further out for affordable housing, or any housing for that matter. At least that's what I've heard from our liaisons at Ways and Vida, that most of that is because there isn't housing in Long Prairie, so they're having to move further out. They're still commuting into work, typically in our, you know, meat processing plants.
Okay.
And can I add, Mr. Chair, that yes, we are seeing them move outside of Long Prairie zip code because of housing. And I think our local employers are encouraging that so they can get stable housing. And I think there's an incentive if you're an employee at the packing plant and buy a home to help them with stable housing. But also the time that it takes to process an application or to see a client, whether it be in WIC or in family home visiting, or even in Stephen's unit with applications to help process these applications of a multitude of languages, becomes very lengthy. Because you're going to connect with an interpreter, and some of them have different dialects, and then you have to find the right interpreter. But that time alone, you could probably double an application timeline from WIC, family home visiting, to all the programs that are available in our financial services unit. It's quite
Time consuming.
Well,
and zero reimbursement. Point two.
Okay.
Zero reimbursement.
And one of the major programs, sorry, Jackie, that we're dealing with, and we've talked about this as well, is they'll come here for work, right? They get recruited to come here for work. After a month, they either dislike the job or want to go back home, but they're stuck, right? And so we're seeing a lot of that with housing crisis and other issues. And we don't have funding for transportation. If someone wanted to return to the Dominican, or often they'll come here without any papers, any documentation, right? And so that has been a huge challenge, is the population that comes here for work and then isn't working, right? And so part of that, again, is whose responsibility is that now, right? And often they come to us. And that's a larger community issue that I think needs to be discussed.
Mr. Chair, that's one thing we are raising to DHS, to the state, through our MAXA and LPHA and SHAC associations, the time that it does take, and when needing to process these applications, work with these individuals, and zero reimbursement to do so. So they're aware that that cost shift to the county is significant.
Okay. Any other questions?
Mr. Chair, could I just add if possible? So Stephen did mention that they are fully staffed, which that's awesome. That's so good that we actually have enough staff, or have staff there. But because of the rules and because of the unwinding and the continual change in rules, they're still understaffed. So.
Yep. We thank you so much for coming in and updating us today. Thank you for everything you guys do. Keep up the good work.
Thank you.
Have a great week.
Thank you.
Thank you.
Anything else? If not, we are done till the night. So
Yeah, 6
tonight,
o'clock.
we,
6.